YouTube channel.
Yes.
What happens at C? What happens at D? C is tricuspid valve closure. V is tricuspid valve opening. So same thing, tricuspid valve closure, tricuspid valve opening. Okay, actually it's TCV opening. So what happens in between? Okay, so between opening, closing and opening, this is ventricular systole. Between this one is ventricular diastole. Atrial contraction only happens towards the end, when you need that one kick to increase the amount of blood flow in. Okay, so that means this is when ventricular atrial relaxation is happening. So you must understand that venous return does not stop anytime during the systole. Whether ventricular systole or diastole, there is always venous return to the heart. So you must know. So the JVP waves can be divided. So there's venous return, venous return, venous return, venous return. So why is there an X descent? You know, here's arterial relaxation, isn't it? So it's in relation to the rate of arterial relaxation. X descent is because of the rate of arterial relaxation is greater than the rate of venous return. And then it starts to go up, okay, because the rate of atrial relaxation is less than the rate of venous return. Venous return is more or less constant throughout. Then V, when the tricuspid valve opening, the rate of atrial emptying is greater than the rate of venous return. And then towards the end, when it starts speeding up already, the ventricle is being very full, it's being full of blood already, the rate of atrial emptying will be less than the rate of venous return. So this one will explain. So if you don't know what's going on, all you have to do is like the 4 phases. Just write VR, 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 AR, AR, AE, AE, more than, less than, more than, less than. That's it. That's how you explain the 4 phases of your JVP. Understand? What happens when there's tricuspid regurgitation? The valve cannot close properly, so what you get is a gigantic V wave until the valve open, all the blood go down again. So giant V you see in tricuspid regurgitation. Sometimes you have if let's say the tricuspid valve is closed but the atrial contract against it, then you have a canon A. Canon A is seen in AV dissociation, but it's not seen in MAV. So AV dissociation will be the canon A will appear irregularly. But if the canon A appears regularly, that means you hear a diastolic movement in less than an H and then the thing boop, 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 then it may be a tricuspid stenosis. Okay? If let's say you have a very tall A and very deep X descent like this, so this one will tell you that this patient is like, it will go, you see the vein, it will go up like this, and then after that it will kind of like empty like this. Then you know this is a very deep one. So what does this tell you? You have your constrictive pericarditis, and you have your restrictive cardiomyopathy. It is very difficult to differentiate with these two. You can only differentiate it using, what we call the angiography to measure. You insert the pressure monitors into the different valves and see how the different atrium and ventricles, and then you see how they react to the infusion of fluid. If a patient is heart failure, their thing is continuously high, and then when the tricuspid valve open, they'll go down like this. So this is CCF. So you see they're descended and then they're going down. So that is CCF. So these are all your different JVP waves. So just now the gentleman you see is giant V, but you also could be a corrigus, but we couldn't feel the pulsatile liver, but because it's mild, That's why the pulsatile lever wasn't filled, but when you listen to it, you hear there was a systolic murmur in the left sternum edge, loudest on expiration. So always time your murmur and always listen to the murmur in maximum expiration. Alright, so this is your jugular venous pressure. Okay, we are going to move to apex beat. You can stop for a while, then we can.